Hey, what's poppin', people? What's poppin'? What's poppin'? So the Food and Drug Administration has made some rule changes where they now allow pharmaceutical retail companies to provide abortion pills to pregnant females who wish to get an abortion outside of the surgical procedure, right? Where prior to these rule changes, the only way a pregnant female looking to get an abortion can gain access to abortion pills is if they go to a certified abortion clinic. At one point in time, I think for the past 20 or 30 years, that was the only way for a pregnant female can get abortion pills. But now, due to these rule changes, retail companies, pharmaceutical retail companies such as Walgreens or CVS can provide abortion pills, which will make it easier for those who live far away from an abortion clinic to gain access to these abortion pills if they're looking to get an abortion outside of the surgical procedure. All right. So this article that I'm going to read to you guys is from NPR.org, also known as National Public Radio. And the article is titled "Abortion Pills Should Be Easier to Get. That Doesn't Mean They Will Be." Written on January 5th, 2023 at 5 a.m. Eastern Standard Time, U.S. And the writers is Vanessa Romo and Sydney Lupkin. And also the link to this article is located in the video description box underneath. So this is a picture of the two abortion pills that pregnant females normally get when they wish to get an abortion outside of the surgical procedure. So I'll begin the article. The article starts off by stating this: more than half of all U.S. abortions are medically induced through a two-pill regimen that requires a prescription but does not involve surgery. And since Roe v. Wade was overturned in June, rates are expected to increase. Now, a permanent rule change by the Food and Drug Administration will allow retail pharmacies to fill prescriptions for the drugs, making the once onerous process of obtaining the abortion pills much easier in states that permit the procedure. But in places with strict anti-abortion bans, pregnant people may still find it challenging to get their hands on the medication. What does the FDA's new rule change? The revision by the FDA announced on Tuesday permanently eliminates the requirement of an in-person doctor's visit for a prescription of Misoprostol, a drug that stops the hormone needed to maintain a pregnancy in the first trimester. The medication has been approved by the FDA for more than 2 decades, but the only way to get it has been from certified clinics due to safety concerns. Retail chains were specifically barred from dispensing the medication. So this drug, like I said earlier, was available for the past 20 years, but the only way for pregnant females to get access to these drugs is if they went to a certified abortion clinic. And retail companies such as CVS or Walgreens or etc., as the article states, was not allowed to sell these abortion pills because the FDA at one point in time made it illegal for these stores to provide them. Now the FDA have lifted that rule, which now allows Walgreens, CVS, and other pharmaceutical retail chains to provide this product. But I'll continue reading. The agency lifted the mandatory face-to-face with physicians at the start of the pandemic, allowing them to prescribe the pill via telehealth appointments. This week, the FDA said that after review, the restrictions were no longer necessary. Misoprostol, I don't know if I'm pronouncing it right. Misoprostol is used to determine, mifepristone is used to terminate pregnancies of up to 10 weeks. It works when it is followed up with a dose of misoprostol, usually taken 24 to 48 hours later. The second pill causes the uterus to expel the pregnancy. Doctors also use both pills during miscarriages to speed things along and minimize infection risk. So the first pill, I'm going to stop right here. So the abortion pills consist of 2 pills. The first pill is called mifepristone, in which that pill stops a hormone. It stops the hormone that causes the female to, continue with the pregnancy and stuff like that. It stops that hormone. The second pill, with a misoprostol, what it does is that it basically causes the fetus to leave the uterus and to spit it out. That's what it does. I'll continue reading. Where will the pills be available and who will have access? Now, the big pharmacy chains are no longer barred by the FDA from carrying and filling prescriptions for mifepristone. The medication could be available at local drugstores and pharmacy retailers. They can also continue to be sent through the mail after telehealth appointments. While no one is required to carry them, pharmacies that wish to dispense the pills would need to meet certain requirements and receive special certification from the FDA. And in all cases, patients still need a prescription. They will not be available as over-the-counter medications. Of course. So, as the article states, any pharmaceutical retail company or pharmaceutical retail chain that wishes to provide the product, their pharmacy technicians or their pharmacists would have to have a special certification provided by the FDA to be able to provide these medications. And of course, these abortion medications, will require a prescription from a certified doctor in order for a pregnant female to get access to these pills. All right. But I'll continue reading. On Wednesday, Walgreens said it plans to pursue certification. We intend to become a certified pharmacy under the program, Fraser Engerman, a spokesman for Walgreens, told NPR in a statement. He added, "We are working through the registration, necessary training of our pharmacists, as well as evaluating our pharmacy network in terms of where we normally dispense products that have extra FDA requirements that will dispense these consistent with federal and state laws." All right. CVS said it was looking at requirements in states that don't already restrict the drugs for medication abortion. Yeah, that's gonna put a lot more money in the hands of Walgreens and CVS. But I'll continue reading. Medical societies say it's a step forward, especially for people who have been marginalized by the healthcare system. Many people have difficulty accessing this care because of things like transportation or having time off of work to go to a clinic to get this care. So this is really going to open the doors for them. Dr. Kristen Brandy, a member and fellow at the American College of Obstetricians and Gynecologists, told NPR. She added that the FDA's conclusion that patients are not at an increased risk by not seeing a doctor in person might pave the way for providers who may have previously been nervous about seeking certification. "I'm hopeful that they will sign on and be able to increase access to their communities," Brandy said. What about states that limit abortion pill access? Pregnant people living in states that already limit or ban abortion pill access will likely not benefit from the FDA's new rules. Yeah, of course. Because The FDA new rules only, excuse me, I'm sorry. The FDA's new rules is only basically benefits those states that allow abortions and that do not have an abortion ban. But for states that already have an abortion ban, yeah, they they won't benefit from this. Because of course, ever since Roe v. Wade was overturned in 2022, now abortion, whether it's allowed or not allowed, is all based on each state. So only states have the power to either allow or disallow abortions, in which prior to Roe v. Wade being overturned, the federal government had control over whether or not abortion is allowed or not allowed, right? So thus, going back to what I just said, so this FDA new rule only really affects states, being that now abortion is now a state right. It only affects states that allow abortions and that also allow abortion pills to be used by those willing to seek an abortion. But I'll continue reading. According to the Guttmacher Institute, which tracks state laws and policies surrounding abortion, 29 states specifically require physicians to administer medication abortions. 18 of those states have already effectively banned the pill use. The pill's use in telemedicine by requiring a clinician to be in the room when a patient takes the Misoprostol. I'm sorry if I'm mispronouncing this word. These medical terminologies, I'm not good with pronouncing them. They're so confusing. That means sometimes people have to schedule an initial appointment to get the prescription. And if the office or clinic is out of stock, then the patient has to return for a second visit to take the pill in front of the doctor or clinician. Meanwhile, Texas outright banned 2-pill regimen after 7 weeks of pregnancy. Anti-abortion activists and legislators have driven the push against abortion medication, saying that easing prescription requirements is dangerous. Sue Leibel, director of state affairs for the Susan B. Anthony Pro-Life America, an organization that calls itself the political arm of the pro-life movement, called the more lax rules a disaster waiting to happen. It is just super reckless that the FDA would peel back these safety regulations requiring an in-person exam. I find it heartless that women's health and safety was not taken into account, Leibel told NPR. She suggested that as a result, more women will wind up in the emergency room, but when pressed for data that might show any increases in ER visits since the FDA temporarily lifted the in-person mandate, she was unable to point to recent studies. Yeah, because like the article stated, earlier in the article, stated how during the pandemic, the FDA temporarily lifted the regulation, making abortion pills easier to access through telemedicine, right? Due to the pandemic, so many places closing down, and due to being it not safe for people to just go out, abortion pills was temporarily available through telemedicine. So, and when that happened, according to this article, there was no proof that this temporary ban, where those who's looking for abortion pills did not have to go to a doctor during the pandemic, actually raised the number of females that ended up going to the emergency room in the hospital. There's no evidence behind that, according to this article. So therefore, when this, female who's pro-life, Sue Leibel, was asked to provide any evidence that during the pandemic, when the ban was temporarily lifted, what were the numbers of females going to the emergency room as a result of not going face to face with the doctor and taking these pills while the doctor's there face to face, this person was not able to provide any studies to back that up. But I'll continue reading. Leibel said she expects to hear from lawmakers in the coming days about how they intend to move forward. I think this next policy session is going to be very fascinating, she said. We're in some new territory here with the decision. It's going to be a mixed bag, to be honest. Yes, the writer did a typo. It's supposed to be, I'm assuming that this word is supposed to be it's, but they missing the I. It's going to be a mixed bag, to be honest with you, in terms of what states will try to do and see what works. What safety measures are in place to protect patients? The Mayo Clinic lists excessively heavy vaginal bleeding and unusual tiredness or weakness among the more serious side effects of Misoprostol that would require immediate medical attention. Still, the physicians and medical societies say medical complications are very rare. The people that actually need emergency care after receiving the proposal is less than 1%, Dr. Kristen Brandy of ACOG told NPR. She added that forcing patients to get the pills in person does nothing to improve medical treatment or prevent a negative response. I would say that there's absolutely no data that suggests that people are going in waves to seek emergency care after medication, and that's because there is really a great track record showing that they are incredibly safe, Brandy said. She also notes that clinical care is not going to change very much. Patients will still be evaluated by experienced clinician. They'll go through counseling. They'll be able to talk about whether or not this is the best choice for them. The only difference moving forward, she explained, is that in the most dire situations, they will no longer have to drive long distances for an exam or wait days to obtain the vital medication. They're just going to have much more easy access to it. This article making it seem like it's going to be a very happy ending, but okay. Now, one of the reasons why I provide this article, not only because it's new news, also because in 2022, when the news first went around the world that the Supreme Court was going to overturn Roe v. Wade, therefore abortion rights would be determined upon the individual for each individual U.S. state to decide. You had a lot of males online who felt that this was a big victory for the male gender, assuming that so many states would ban abortion, when in reality only 13 out of the 50 states in the United States either have a complete ban on abortion or have a near ban on abortion, right? But they felt that this was going to be a big win. And I even stated on prior panels talking about the topic that the only thing that something like this will do, what I mean by something like this is the overturning of Roe v. Wade. The only thing that it will do is provide more alternative ways for people to get abortion access. Now, you guys or someone who may hear what I just said might say, hold up, Wacky. Didn't the article say that the abortion pill will only be provided in states that allow abortions and or allow abortion pills to be used? Yes. But then, once again, you got to understand this. For people living in states where abortion is not allowed or abortion is banned or near banned, they can easily go to another state or the next state over where abortion is legal and pick up these pills. And not only that, I think I either I was on a panel prior, right? And I gave information on how you have now there have been mobile abortion clinics, right? Mobile abortion clinics or just mobile abortion centers where they're located in state boundaries that can provide access or abortion access to those living in states where abortion is illegal, making it easier for people who live in states where abortion is illegal to go to the state boundaries and get abortion treatment, right? And since those looking for an abortion don't have to be face to face with the doctors to get these abortion pills, guess what? People living in states where abortion is illegal can go to these state boundaries, pick up them pills from the mobile abortion clinic, and go right back home. Like, and like, how are people going to know, or how is authorities going to know that each person that's traveling in their local town or city where abortion is illegal is carrying abortion pills? What are the chances of authorities knowing that? So, therefore, knowing this, how is this a win for the male gender? Now, granted, I understand that there are males and females who disagree with abortion, right? Who think that abortion is immoral and what have you. I totally understand that. But to think that somehow states are restricting abortion access is a win for the male gender, I don't see how that's a win. How is that going to improve the social, economic, and political plight of males in America? You know, especially when there's alternative ways for people that live in states that ban abortion care can actually still get it by traveling to other parts of America. Now, being that these abortion pills now can actually be sold in CVS or it's in the local CVS and Walgreens in different states. The only thing a person needs to do is travel to a state where abortion is legal, go to a certified doctor, get a prescription to get this medication and buy it from the local CVS and or Walgreens. And that's it. And doctors are not going to turn down people that live in other states. A doctor is not going to say, hey, listen, you don't live in this state, therefore I cannot give you treatment or do a check on you to see if you are certified or not certified, to see if you are able to get this medicine. Okay? Doctors are not allowed to turn people around just because they don't live in the same state as they do, or just because they live in a different state. So therefore, how is the overturning of Roe v. Wade a win for men? And this is not and the case of abortion, it should not even be a male versus female issue. The case of abortion is a morality issue. That's what it is. It's really a morality / political issue. It has nothing to do with the male and female gender war and shit like that. And not only that, but if people who are against abortion truly care about stopping or reducing reducing the numbers of abortion, even though abortion have tremendously reduced since the 1980s in America, what these people have to look at is what are the factors that are causing females to want to go out and get an abortion. And when you do the research, you'll see that the main factor that caused females in America to go out and get an abortion is poverty, because the overall majority of females who gets the abortion treatment are living underneath the poverty line or close to the poverty line. So if people really care about getting rid of abortion, then why don't you focus on getting rid of the environmental factors that cause people to get an abortion, like poverty? And I'm saying that because during the time when the world first heard that the Supreme Court, the U.S. Supreme Court, would overturn Roe v. Wade, a lot of people, a lot of males on the internet felt that it's necessary to actually put females in a position to force them to stop getting abortion by removing their right to an abortion. And the thing is, whenever you study the history of man, you'll see that there's nothing good that comes out of forcing people to do something or removing the rights of people. Nothing good's come out of that. Nothing good comes out of that in the long run. But once again, I don't see how the case of abortion is somehow a war between males and females, because the whole abortion topic, whether or not it's right or it's wrong, is a moral issue as well as a political issue, because you have both males and females who are on both sides of the abortion spectrum, whether they are pro-abortion or anti-abortion or in the middle. Yeah, but I'm done speaking about this topic. What do you guys think? All right, peace.